Joining me this morning from Mountain Laurel Integrated Healthcare is family nurse practitioner Whitney Miller. Good morning to you, Whitney. Thank you so much for being here this morning.
Good morning. It's so good to be here with you.
We are happy to have you. First, if you wouldn't mind, tell us a little bit about Mountain Laurel Integrated Healthcare and some of the services that you all provide.
Of course. We are originally known as Logan Mango Area Mental Health, and we have been the premier community health center in Southern West Virginia for now 5 decades. In 2020, we actually earned our second designation as a federally qualified lookalike center, and that allowed us to expand on our services, our resources, and our capabilities. Although we do still serve as a behavioral health center, we are now one of the highest in medical excellence in primary care, pediatrics, women's health, dental services, and addiction medicine.
That is fantastic. So as a nurse practitioner at Mountain Laurel, what exactly is your day-to-day? What do you treat?
Everything.
Everything.
We do offer that expansive list, so we see everything from your sick visit to your mental health visit, anxiety, depression, even those that are very severely mentally ill, high blood pressure, diabetes, chest pains, ankle injuries, you name it, they come into the clinic and we do not turn anyone away. We treat everything.
Wow. Okay. And I know we've touched on this a little bit, but, you know, as far as maybe some of the expansions and the services that you are able to provide, you know, what is the wide range of things that you on a day-to-day basis are able to do for patients?
Well, we are able to offer our own in-house pharmacy, laboratory services. We already mentioned, of course, primary care, pediatrics. We offer that as well. And we offer dental services. We have also Dr. Russian, who offers our hepatitis C treatment. We have community engagement services and transportation for our patients, and that allows us to get patients to and from their doctor's appointments, even to the grocery store. We help with financial assistance and even help them later on in finding a job in the community.
Well, that is great because that takes a big burden off of that. I mean, for a lot of people, that's the biggest challenge, right? It's just having that transportation to get to and from the doctor. That's great. Tell us, for a patient who may not have yet had a visit but is going to be coming to you, what would a visit for them at the healthcare center look like?
Well, initially that would be started by our nurse, who would take them back into our clinic and do what we call an intake, where they would get their vital signs, their weight, allergies, their medication list, any prior medical history and surgeries. They would document their chief complaint, and that would include why are they there in the clinic today and what symptoms may be surrounding that.
And Whitney, from there, what happens after maybe that kind of that initial visit with them when you first sit down with them? Then what would take place?
Well, as a medical provider, we try to focus on that chief complaint initially and gather as much information around that as possible, such as when did it start, what may have preceded that, have they had prior treatment in the past. And in each visit, we also try to incorporate preventative services and primary care. We understand as medical providers that mental illness can be caused by a physical condition, so we always offer lab services and try to check vitamin deficiencies, thyroid levels, kidney functions, make sure they're not anemic. We also offer those preventative services such as breast cancer and colon cancer screenings. We address diet therapy and exercise therapy. We try to help prevent obesity, or at least address it, and prevent further heart disease or diabetes. We address nicotine dependence and offer smoking cessation therapies.
No, Whitney, as far as that name, integrated healthcare, I'm sure to patients it's probably, oh, well, that's just a part of the name of the healthcare center, but to you it is a whole lot more. What exactly does that mean for the facility to be an integrated healthcare center?
Well, our model at Mountain Laurel Integrated Healthcare is integrated care, and that means treating that entire patient no matter what their need may be. We look at them as a whole. We are very proactive in treating our patients, and we know that they not only need medication or counseling, but maybe they just need an ear to listen in their visit. Maybe they do need transportation services, and that's a big stressor for them. Maybe they need financial assistance, or maybe they have a very rough home life and they need to talk about that or need help with that. So from there, we try to look at that patient as not just a patient, but as a person who is there and really needing help. And once you can understand what they are going through, you can really become the change in that person's life that they may have never had. And that is why our motto at Mountain Laurel Integrated Healthcare is where change begins.
Well, and it is so nice to have trusted healthcare professionals that are near your area, that you don't have to be traveling long distances to get to. Whitney, before we let you go, if somebody is interested in your services, wanting to find out more, or maybe even schedule a visit, how do they go about doing that?
You can always call. Our number is 304-792-7130. We also have a Mingo County Chattaroy location, and that number is 304-235-2954.
Well, Whitney, it was great to talk with you this morning. We really appreciate you stopping by and talking with our viewers about the services that you all are able to offer. Thank you.
Thank you. Thanks for having me.